I use the table extensively in anatomy and physiology, and the goals that I had when I first started teaching are definitely different than the goals that I have now. And I think that I've evolved as an educator, and I'm trying to bring more real life experience into their life. So one of the main things that I want to do is I want to expose them to the language of the medical world and understand the human body system and disease. And I think it's an important thing for their own health as they're moving forward. I also want to expose them to 21st century skills, specifically in technology. I want to expose them to job-related skills if possible. Some of those are soft skills, some of those are hard skills. However, I want them prepared to leave our high school and take something forward for an employer. And again, one of my main goals is expose them to real world situations within the medical field. What I found over the years is that our students as a generation, they like to memorize, and they don't like that uncomfortable feeling of having to solve a problem without the teacher telling them what to do. So I have been trying to create things to make them feel uncomfortable and have them try to problem solve their way through the situation. One of my other main ones is creating an opportunity for them to connect to life for 10 minutes a day. Maybe they go home and they talk about what they learned in the respiratory system because we have COVID in this world, or they go home and they talk about the idea of malignant or benign because they've had a family member that has cancer, or they go and get a test and they read about the report and they're able to understand that. And that's one of my goals as well, is giving them 10 minutes a day of anatomy. And the final one is I want them to be able to take a look at Grey's Anatomy. And I was a huge fan of House, and to be able to understand what's going on. For those of you who like those type of shows, I highly recommend Diagnosis. It's on Netflix, and it's the one doctor is a creator who helped with House, and they crowdsourced some of the most unique diseases that are out there. And I'm about 7 episodes in, and it's pretty exceptional. So that is my goal, is these 6 things are what I want from my anatomy students. So to go back, we've had the table now. This is our 3rd or 4th year that we're having the table. And I can tell you that at first it was extremely overwhelming because you have this powerful piece of technology and you're trying to integrate it into your curriculum. So the first question I have is, how can I use this tool in every unit that I teach? And then can I get all of my students to learn some of the table skills that exist? So I had to personally take a step back and kind of take anatomy and have it on one side, and then take the table and have it on another side. So you're going to see activities. I start where we just work with the table, and then I hope to integrate the two and provide a full curriculum with both the table and anatomy and phys. And how can I expose my students to things on the table that they would not normally see in an anatomy class? And how can I blend real patients with the table? And so those are my table philosophy that I have on top of the anatomy and phys portion of it. So what I'm going to do is I'm going to go through some activities that I've used. Feel free to ask. Some of them, they start simple and then we get a little more complex. But the 5 big ones that I have integrated into my curriculum are, we're going to introduce them to the table, and then we're going to go through the Anatomage preset activities, histology. We're going to do something with patient interviews. Can you find the possible problem? And then there's a digital notebook grab bag. Can the activities be used on the veterinarian side? I imagine they would be, yes. Okay, so we have, whoops. All right, so the opening activity that we have, hold on one second, I'm just trying to get rid of one screen there. The opening activity that we have is, as I call it, what does this button do? And the intended goal of this is to exposure to the icons on the table and allowing students to figure out what each icon does and where it is located. So this is nothing more than basically a play period for them. And I'll show you what I do because I had to take a step back and I had to let them touch the expensive piece of equipment without fear. I mean, we obviously have rules, but my students actually love this. And what my setup is that they get roughly 15 to 25 icons. I'm going to show you what some of them are. I have a video here. And the students can explore what those icons can do. And they must explain what each one of them does. So they're going in blind to the table. And we're going to use the gross anatomy section, which is where they have 4 cadavers. And they have exploratory free time. There is no foul, there is no penalty, anything along those lines as they're going through and learning how the table operates, because I want them to have freedom to operate the table without me looking over their shoulder and the chance to learn as they're going. The assessment on this was, for me, is we did either verbal questions or in this case, I gave them a quiz at the end of the year. What does this button do? Time frame for this is that depending on my students, so I used this for my anatomy class this year. I actually thought that it was going to take 20 minutes. And the reality was that my anatomy kids took 60 minutes. And it wasn't because they were fooling around. They did it over 2 periods. They went through, they were doing a comprehensive look and trying to understand what each button did to get familiar. So my feeling was that the time that they spent, they got more mastery out of everything. How many do I have on the table at one time? For this one, I actually have people, it's normally about 8 to 10. Now, my anatomy class this year is smaller, but I definitely allow them to get around the table. In my setup, I also have 4 TVs where things go to. So some people look at the TVs, some people are at the table and they're actively touching, and then we kind of switch. So I've done it where some are looking at a TV, some are at the table, but the class does like to get around, and there was a lot of verbal interaction as to what was going on. So this is a brief minute video. This is one of the cadavers, and I'm just going to show you some of the things that we do. I didn't spend too much time on this because it's here for you to see.
Activities that we do with our students on the Anatomage Table is I bring them here into the gross anatomy. This is one of the 4 individuals who donated themselves to science. So we have their cadavers here. And the first thing that I do is I let them orient on the table. They're going to learn that you can move the cadaver as you see fit. And then you can reset them by using some of the buttons over here. So the students have a worksheet with a large majority of these icons over here, and they get to play, including using the levers listed down here or shown down here, so that they can play as they're moving in and out. And meanwhile, they're learning the functions of each one of these icons. And we start talking about location and direction with these students so that they have a basis, because we're going to be using it throughout the year. Like here's pinning, and we can take a look at pinning, and we can pin certain regions on the body, and students get familiar with what they're doing as they're going through the table and learning what the icon.
And the reason I like doing this is because, again, I do this after right in our first chapter, which is basically directional terms. So there's cutting segments down here that actually cuts them into planes. So it's cool to hear the students going, oh, that's cutting them in a medial plane, or, oh, that's cutting them into a frontal plane. So it's prime time to do direction and introduce this so that they get to see how the body can be cut. And it's not something that I can necessarily do in the classroom. I mean, they see pictures, but here they get to actually physically experience it. What we also have is the Anatomage PREMADE activities. I have been using these, and the importance of this is that we have what is known as a links period that occurs either in the middle of the day and the end of the day. And my design is for them to get exposure to the table and do some of these pre-made activities on their own during our links period. We also have been using these for our gifted students because the table has been written into some of our gifted IEPs. And I use this second because they've already established some level of skills in their first activity so that they can come on and do the activities on their own. And for this, I normally like them to be in 2 to 3 students. So this is perfect because it allows them in a smaller group to go. You already have something set up by the company, and they can go in and they can start expanding their skill set with these activities. The assessment on this is the completed documents are scored. Time frame for this is anywhere between 20 and 40 minutes, depending on how competent they are. They do tend to speed through these a little faster as they get better because they have competency in table usage. So this is good to see because, again, we're building something. This is not something that I created, but it's a tool to help me bridge their table skills and their anatomy skills. This one I used extensively in histology. For me, for histology, it's basically our 3rd chapter. And my expectation is that they are able to identify histology tissue by sight. So we have what I call the tissue test, in which they get slides and they are required to identify what type of tissue it is. And for some of them, they have to go through parts and function of those parts. So for instance, this picture is cardiac tissue, and we talk about the intercalated discs, which are these lines right here. We talk about the nucleus, and we talk about the structural difference between this and striated muscle. But what I'll do is I will put this up, and the students, we're a 1-to-1 school, so they have computers. So I put this tissue up and I go, okay, this is the tissue. I need a function location, and I need you to identify the parts. And then what I do is I call on a particular student to come up and physically write on the table. And you're going to see a video of this. This has stretched out my histology pretty extensively. It's probably about 8 to 10 days because we're going through roughly 2 to 3 tissues a day. And those tissues are taking 7 to 8 minutes. However, the students love it. They like the ability to go and write what they found actually on the table. And again, it was me linking to the idea of having students increase the table skill. So here's another video. There's a histology tab on the table, and I'll show you this real quick. So when they're resources are the students using, they are either using their book or they're using the internet. And some of them are like common sense. And what I mean by that is if you're looking at cardiac tissue, I try to teach them, what does cardiac mean? And what do you think it does? So I don't necessarily have them rely on every resource unless they're looking for some of the harder ones like stratified squamous. So their resource is their book, their computer, and me, but it's also a discussion point. And I make a student talk about that tissue in particular. So another short video here.
Favorite activities to use the table is when we get into histology. I make my students responsible for identifying tissues by site. And when you go into the histology section of the table, they've already broken it down into epithelial, connective, muscular, and nervous system tissue. So in this case, I'm going to pull up a cardiac tissue. Now, the reason that I like this and I do this after the fact is that we'll have a tissue up here and I'll either lead them or I'll make students lead this, but they can use the pen tool and then they can start drawing like, what is this? And circling. So I do this after they've established some understanding of what the tools are. And in this case, it's good to get a student up and showing what they can identify on the histology tissues. And again, we go through about 15 different tissues on here. So again, that's why I kind of do the introduction to them first.
So your question about the ViewSonic, I'm not familiar with what a ViewSonic is. We use TVs and we have a high definition cable that goes, we have 2 to the left side of the table and 2 to the right side. So I imagine that there should be some display option, but I'm not familiar with what ViewSonic is. It's a TV that projects the computer. I'm out of my technology world on that one. I'm going to have to refer to Jake on that one if he wants to answer that. Okay, so this was actually the one that I presented at the user group meeting. And this was patient interviews. And I came up with this basically last year, and the students were exposed to a real life individual that is linked to one of our case studies. Students are required to interview the patient to determine what system they want to check. In the process of questioning the patient, the student must check vital signs, cranial nerves, explain HIPAA to the patient, and they're going to be faced with a real life, real time problem solving skill. So what we do in this one is that I go to a table case and I find out something. There's a case on here I can actually show you. It's case number 793, in which the person has a massive glioblastoma in their frontal, parietal lobe, and it's about the 2 golf balls in size. And what I do is that I then create basically the type of a card for the patient to come and act like they're going to an emergency room. And my students are responsible for interviewing the patient as to why they came into the emergency room. And this in itself takes roughly about a day and a half for me, because we go over the things, and these are some of the social skills that we need to work on. We go on probing questions. We talk about the idea of tact and empathy. So what I do as a precursor to this activity is I make my students interview me. And what they don't know is that I sit, and first off, I change my gender, I change my age, but they're all linked to cases on the table. And I make them try to figure out where they want to look. And so that is day 1 of this. And I don't necessarily do these sequentially. However, I get students involved. You have to interview, you have to find out what's going on with the patient. We then spend a day on the idea of checking vital signs. So we talk about, and I probably spend about 2 days on this. We talk about breathing rate, we talk about heart rate, we talk about blood pressure, and I teach them as best I can about how to take blood pressure. So we talk about the Korotkov signs and how they can hear and what they should be hearing for. I don't stress over them having mastery of the blood pressure because it's hard. So we have some automated ones. We have Vernier that you can plug into a computer, and I have some automated ones that are like take home. And then another day leading up to this is I have them go through the testing of the cranial nerves. And then we discuss HIPAA because this was a big one and an interesting one. They didn't understand fully what HIPAA is and what allows them and not allows them to do. So these 4 bullet points that I have, this is basically somewhere between 4 and 8 days in prep before they get a patient. And the patient that I had last year, my anatomy class responded very well to them. And there was truly learning going on because they interviewed, then they went back and they looked and they went back and started asking more probing questions. The idea behind this is that the way that I did this is that I had 14 people in an anatomy class last year. I let them into a group. I was actually observed for that activity, and my principal gave me the idea of next time splitting them into 2 groups and letting them determine whether or not they would get to the same point. So I thought that was cool, and I'm probably going to be doing that this year, where I'm going to make little teams. They're all going to have the same patient, but can they get to the same conclusion? I prep the patient that they have to be giving signs and symptoms that lead them to a specific system, although they can be a little general, in which I want the students to be able to narrow down where they would like to look and what they would like to look. So in this case right here, and I don't remember what the case number is, this individual has an isodense tumor that has eaten away the transverse process of the spine. And this is easier for students to find. If we have time, I'll show you another one that I did. The interview can take anywhere between 20 and 30 minutes, depending on how they go, but you're looking at somewhere between 5 and 6 days for this type of activity. Actually, I want to go back. And while I don't have it listed in here, I've actually done this the other way. And this was one of the more powerful things that we did in my classroom. I gave the students the case, and there's the case history there, and they have the pathology report. And for every case that I gave them, they were cancer, and I put them in small teams of 4. And they then had to deliver the news to my faculty, who were acting as patients themselves, and they didn't know what they were getting into. And I had an English teacher that did fantastic in being very emotional. So the students had to come up with a game plan of what they were telling the patient. They had to come up with a game plan of what their diagnosis was. And then the teachers who were acting as a patient, they actually rated the quote unquote doctors and how they responded. And the reason I'm bringing this up is because I had a student, a female student who was in our med tech program at our BCTC, our Career Technical Center. And she was in my CP anatomy. And without a doubt, this female's bedside manner was the best I've ever seen. Very quiet in class, but my gosh, she got into this assignment and absolutely blew it out of the water with her bedside manner. So much so that the teacher who was evaluating her and what she was saying even wrote in the report that she was fantastic. Wrote home to mom and grandmother about what she did, and it was just simply amazing. It was something that I did not expect, and it was really cool to see. The last thing that we have, or that I'm looking at, is that I wanted to make have the students almost create a digital notebook, because you can take pictures on the table. And the way that I wanted to do this is they have a flash drive, and for each unit, I wanted them to pick an activity out of almost like a grab bag. So for instance, I have here, pick a color this muscle. So, and I wanted this to do for every system. So let's imagine we're at the muscular system. So they're going to pick a muscle out and they get the pectoralis major. And then they have to pick a color out or another action, like color that one green, make sure it's labeled, find something either inferior, superior. So each of these underlined words was designed to be an activity that the students had to do. And then they had to take a snapshot of it for that unit and store it in a digital notebook. And where the individual aspect of it comes is that the way this is working in my head is that when the students grab something out, their next person coming through is not going to have the same thing. So I'm going to be looking at a student through 8 different units with a different table, skill, activity, and their I don't have this up and running only because I'm in the process of talking to my principal about tips on assessment, et cetera, et cetera. So this is an activity that I'm trying to get up and running, but I'm almost there and I hope to have this up in January. So it's at this point, this is my contact information, okay? I teach at Ole Valley High School. I'm located just north of Reading. That's my email. What you need to know is why I can't see your faces. I love talking about curriculum and activities. And if you want to do a joint activity, if you want to talk about something, go for it, because that's what we do here in my building. I talk to a math teacher, a tech ed teacher, an engineering teacher, and we go through and we talk about lessons in design. So it's probably one of my favorite things to do. So if you have questions or if you want to contact me and work with something, please don't hesitate to ask.